Okay, so we mixed up our alginate and we're going to take our lower impression. So I have my patient here. So you always want to explain to your patient what's going to happen. So I'm going to take this lower impression, so I'll have you open. And you want to make sure it's seated on the lower teeth and the posterior teeth first. And then you roll forward and lift your tongue up through there. And then you can relax it. So prior to this, I did select my tray size. And you want to make sure when you're trying in your tray that it covers all of the teeth. You want to explain to your patient. You always want to make sure they're comfortable. My patient here looks pretty comfortable, not gagging or anything. And it takes about 1 minute to 2 minutes to set up, depending on the type of material and how warm the water was. You're doing okay? Mm-hmm. All right, so that looks good. So you always want to keep your fingers in the patient's mouth. You don't want to set the impression and go do something else because it can move and modify it in a way you don't want. So we'll just sit and wait here for a couple minutes for this to set up. When it's set up, you should be able to push on it and there's no pushback. If you try to put your nail in there, it shouldn't make an indentation. And just keep monitoring your patient, making sure that they're doing okay. So that looks pretty good. We're going to go ahead and take it out. So when you take it out, always want to break the suction on the side and pull straight up and take the impression out. And that was our lower here.
Thanks,